Hi, Dr. Parashar.
Hi.
Dr. Manisha, good evening.
Hi, good evening. Good evening to everyone.
Dr. Laksh.
Yes, sir.
Good evening to you.
Good evening, sir.
Good evening, everyone.
Good evening, everyone.
Ravina, we'll start.
Yeah, we are live.
Good evening, ladies and gentlemen, and welcome to what we promise will be an exciting hour of deep dive into a topic that is not just being intensely debated in the medical circles, but will also have a direct impact on the way you will be diagnosed and treated in as little as 5 years from now. The Hindu webinar today examines the central government's proposal to integrate MBBS and the Bachelor of Ayurvedic Medicine and Surgery. This debate will give you a 360-degree look into the issue. And for this, we have with us today four very well established names in the field of medical science. We have Dr. R.P. Parashar, National President of the All India Doctors Association for the Indian System of Medicine, Dr. Rajiv Jayadevan, former President, Indian Medical Association, Kochi, Dr. Lakshya Mittal, Chairperson, United Doctors Front, and Dr. Manisha Mishra, an Ayurveda doctor, teacher, researcher who has been working in the field for over 2 decades now. So, diving headlong with you into this discussion and starting with Dr. Rajiv and Dr. Manisha, we'll start with exploring the question about the integration of MBBS and BAMS into a single integrated course, which has sparked controversy and opposition. Some are calling it a mixopathy. So, would you actually say that this is a mismatch of medical science, or is it just an expansion of the knowledge base for a medical student? I would like to start with Dr. Rajivan, please.
I represent modern medicine.
Yeah.
And modern medicine is basically the global standard of healthcare across countries with no borders. And in India, modern medicine is taught through the MBBS course. And for our viewers, this discussion is not about the merits or demerits of modern medicine or Ayurveda. The question that we are debating is whether we can mix these curriculum, whether they can be incorporated into the same curriculum. So that is the core of the discussion here. So since I represent modern medicine, I'm not a trained Ayurveda physician. I can say that modern medicine is founded on certain principles. Specifically, it is founded on evidence-based medicine. Now, that is something that has evolved only in the past 200 years or so. And evidence-based medicine basically is founded on proof. Whatever you say or believe has to be based on proof, which takes us to the principle of falsifiability. What is falsifiability? Falsifiability is basically if I say that water, if you heat water at sea level to 100 degrees, it will boil. Now, that's a statement I'm making. Now, I should be able to defend that statement, and that statement should be provable, either true or false. Now, that is a falsifiable statement. But suppose I say that a disease is caused as a result of something I did in my past life. Now, that is not a falsifiable statement. That's a belief-based, culture-based statement. Now, that is a difference between a falsifiable statement and non-falsifiable statement. So, modern medicine basically is founded on you cannot say something or believe something that is not provable. So, if you make a new claim, you have to back it up with evidence. If you look at the history of modern medicine, it's been changed over the years. Whatever is not working has been discarded, and new treatments or better treatments are always brought in. For example, the treatment of hypertension, blood pressure, when I was doing my MBBS in the 80s, that's no longer the treatment that's followed now because better treatments have been invented and older treatments have been discarded. Now, that's not the case with most traditional systems of medicine, which includes Ayurveda, as I understand. And traditional systems of medicines are part of our culture. And every country, as I understand, has its own traditional system. It's not just India that has traditional system of medicine. And they deserve the respect that they get in present day. But the question is, can you mix them? The answer is a plain and simple no. Because The systems are completely different, founded on different principles. I'll explain it like this. Imagine a car and a train. They're both designed to carry people from one place to the other. But a train can travel very well on a track because it's designed to carry a train. Can you put a car on a track? No. Can you put a train on the road? No. So the two can run parallel to each other, but not in a mixed fashion, because it will lead to unnecessary consequences, which we will get into if we get time later on in the discussion. So the answer is a plain no. The systems can exist in parallel, but mixing, absolutely not.
Dr. Manisha, if I can bring you in, you've been in the field for over 2 decades. Aren't we talking about just one human body, its diagnosis? So how is it possible that that we segregate systems of medicine into tight compartments? Does that really help us, or should we allow our knowledge base to be wider and then we go into specialized area?
So let me summarize Ayurveda for everybody. Though it is a millennia-old science and it has its own virtues, it works probably mostly on health preservation. Then comes disease prevention. And if at all people fall ill, then comes the part of therapies.
Right.
So largely, of course, it sounds very poetic, and it is not that any disease happens due to past life karma, as Dr. just mentioned. It is based on dosha. It might sound poetic, but it is not. It is bioenergy based system. It is systems biology. It is physical. So it talks about physical attributes, mental attributes. It also talks about prasanna atmendriya manaha. So there's a talk about soul, there's a talk about emotions, and a balance between all these things. Apart from that, lifestyle, your vihar and your ahar, how your diet is, defines your prakriti, your genotype, your phenotype, and basis that we tell people they are probably at risk of certain diseases, and accordingly, from very early on, they make changes into their lifestyle and diet so that they don't start knocking the doors of a hospital. And just in case something happens, there is therapy too. At some point in time, there was surgery and therapy both, but over a period of time, I think surgical skills have been lost. It's not so strong right now, but physically and therapeutically, it has its own virtue. And the way it works is looking at a person as a whole and not as a part. So though modern medicine is a precision-based science, it is about, Ayurveda is about regulating your physiology and restoring whatever has been destroyed or sort of out of balance. So that is what the approach is. And if I have to say whether I appreciate there has to be an amalgamation of modern and Ayurvedic, I would say yes, it has its own pros and cons. But a holistic patient care would be the major thing. See, end of the day, why is there a healthcare system? So that there is best care given to somebody who is unwell, be it modern science, be it Ayurveda. So if there's a holistic approach, even if it is an acute condition, they could diagnose with the best of things they have developed over 200 years, good diagnostic skills, and then accordingly incorporate Ayurveda diet and lifestyle to improve the entire overall scenario. That being one. The second is a better patient-doctor communication also would entail, because currently, if you see, even if a person is taking modern medicine, in the corner, because of its set systems, he might be taking certain things which could be supplements only and would not tell the doctor in the process of thinking that he might be judged that he's taking XYZ supplement. So if something like this comes together, the person is open. In fact, the doctor is also aware if these things are okay, not okay to take. It also is good for the primary healthcare setting. It's easy for people in rural areas to have these kind of approaches. It also takes care that people do not end up overspending, first going to this therapy and then going to
Absolutely,
that
the
therapy.
economics of it, the economics of providing medical health care. So we will come back to that, and I would like to bring in Dr. Mittal. Dr. Mittal is, we look at MBBS, the modern system of medicine, and Dr. Rajiv also. Are we looking at a preventive system of medicine when we are talking about MBBS, or doesn't Ayurveda offer you a more holistic, where you take in your environment, you are doing preventive medicine rather than treating symptoms, treating the disease, giving vaccinations? So, what is the fundamental? I mean, wouldn't it be better that we offer a more preventive rather than curing the disease as per the symptom-based treatment? What are your thoughts about that? Dr. Mittal, if I could start with you.
Yes, ma'am. Ma'am, actually, I would say it would be very thankful to all the Hindu team and my panelists that it's a great important topic we are talking about, which implies the medical education as well as the patient care.
Yeah.
When we talk about, ma'am, the integration, the MBBS and BMS, the modern medicine and Ayurveda,
Yeah.
मैम इट साउंड्स वेरी आइडियलिस्टिक कि बड़ा ऐसा फील होता है जब ये बोला जाता है कहीं भी, अगर आम जो मैं आई एम टॉकिंग अबाउट फ्रॉम ऑल द फीडबैक्स फ्रॉम द मेडिकल स्टूडेंट्स, PGJRs and the youth, mainly youth resident doctors and medical students जिन पे ये इम्प्लाई होगा
जी,
उनकी फीडबैक्स प्लस जो आम लोगों से भी हम जब ये चीजें आई थी ये जिपमर में जो ऑनरेबल मिनिस्टर ने ये स्टेटमेंट दिए थे, उसके बाद जो हमें DMs आए हैं, मेल्स आए हैं, उस बेसिस पे कंबाइंड मैं आपको एक फीडबैक इस पे बताना चाहूँगा
जी,
दैट इज कि ये बहुत आइडियलिस्टिक सा साउंड होता है कि बहुत अच्छा माइट बी इट बी पॉसिबल एंड ऑल, बट आज का जो सिनेरियो है इन टुडेज एरा सिनेरियो, इट इज मेडिकल एजुकेशन ऑफ भारत इज ऑलरेडी डिग्रेडिंग. ये ऑलरेडी जहाँ पे जरूरत है मेडिकल एजुकेशन में भारत की लगातार आप देखेंगे MBBS की सीट्स हैं चाहे ड्रास्टिकली एक एक्सपोनेंशियल नंबर में इंक्रीज हो रही हैं.
जी, जी,
without even looking into the existing medical colleges, उनका क्या इंफ्रास्ट्रक्चर है, वहां पे क्या एजुकेशन है, मतलब ये सब जगह ही है, नॉट इन ओनली इन MBBS. आई गेस ये आयुर्वेदा में भी यही सिनेरियो हो रहा है, बस गवर्नमेंट इज जस्ट मतलब
एक्सपेंशन हो रहा है,
एक्सपोनेंशियल विदाउट इवन लुकिंग इनटू दैट कि जो हमने किया है एटलीस्ट अ ईयर और कुछ स्पैन कुछ 6 months या कुछ भी एक, कि वहां पे ऑडिटिंग इंस्पेक्शंस प्रॉपर हो रही हैं, क्या वहां पे प्रॉपर टीचिंग फैसिलिटीज अवेलेबल हैं, क्या वहां पे जो डॉक्टर्स बन रहे हैं जो कि डायरेक्टली पेशेंट केयर के साथ कल को डील करेंगे. जो MBBS स्टूडेंट एक फिजिशियन बनने वाला है वो एक तरह से जनरल प्रैक्टिशनर होता है, जो MBBS कर लेता है या BMS भी कर लेते हैं, वो अपने फील्ड में, आई डोंट नो मच अबाउट दैट Ayurveda and all. My family, there are some good friends also from Ayurveda. Everyone, जो भी we respect everyone, चाहे वो होम्योपैथी है चाहे आयुर्वेदा है, सबकी अपनी अपनी पैथीज हैं, सब अपने तरीके से चले, बट हम उनको नहीं यहाँ पे निगलेक्ट कर रहे हैं. द स्टूडेंट्स, द मेडिकल स्टूडेंट्स जिन्होंने ये MBBS करनी है या जो मेडिकल स्टूडेंट्स BMS कर रहे हैं, क्या हमने उनसे उनका पर्सपेक्टिव देखा, क्या उनपे क्या बीत रही है? दे आर ऑलरेडी स्ट्रेस्ड अप. 5.5 years का ये एक बहुत ही
रिगरस कोर्स है, बिल्कुल बिल्कुल.
BMS अपनी जगह है एंड MBBS अपनी जगह है, और इसको हम सोच रहे हैं कि कंबाइन कर दें. दे आर ऑलरेडी वेयर मेडिकल एजुकेशन इज डिग्रेडेड, और जो भारत का जो सिनेरियो अभी करंटली चल रहा है, तो बजाय मुझे लग रहा है कुछ नया हाइब्रिडाइजेशन करना और उसका अमलगेशन करना कि ये एक्सपेरिमेंट्स की बजाय वी शुड वर्क ऑन द एग्जिस्टिंग सिस्टम्स. क्या प्रॉपरली आयुर्वेदा जो है वहां पे स्टूडेंट जो एक्चुअल में जो लोग हैं, आम जनता जो है, पब्लिक जो है, इट शुड बी ऑलवेज इन द लार्जर पब्लिक इंटरेस्ट वेदर ऑन एक्सपेरिमेंटिंग द थिंग्स. है ना?
जी.
The students always become the guinea pigs. This should
Are the
not
students
be.
becoming the guinea pigs, or are the patients becoming the guinea pigs?
Both, ma'am, both will. If
Yeah.
the medical students will guinea pigs, then these students only will go to do the PGs in MD in the Ayurveda also and MD,
जी.
or whether they generally practice directly. आप देखिए directly indirectly आके patient care ही effect होगी मैम
बिल्कुल.
कहीं ना
So,
कहीं.
Dr. Parashar, I'd like to bring in Dr. Parashar here कि सर तो ये एक unscientific मिक्सोपैथी जो बोला जा रहा है, ये unscientific है, ये does it compromise with patient care, या patient को actually बचाता है कि they don't go to quacks, they don't end up having medicines on their own. Even Ayurveda mein you can have a lot of side effects. If you're mixing a lot of chemicals without actually knowing, without actually going to a proper doctor. So if a doctor is trained in both, he has an idea about both, he can actually guide and probably even protect the patient's health, overall health, when you are aware of both these pathies. So what would you say about this, Dr. Parashar?
The aim of Ayurveda is to make a healthy person healthier, and
I think that's the aim of all pathies, to ensure that you have good health.
And to treat the patient.
Yeah.
And that should be the aim of each and every medical professional, whether he is from allopathy, Ayurveda, Unani, homeopathy, or someone else. So the parallel streams are going on since a long time in India. And if we say it experimenting, so there is nothing wrong in experimenting. If we see China,
the
traditional medicine in China is the main pathy, and the modern medicine is sporting there in hospitals, in health units. The single pathy, that is the modern medicine, along with or supplemented with the traditional medicine, it is the pathy of China. So if it is experiment, as can be said, so why can't we experiment in India? And as far as evidence-based, the question, it is very crucial.
Yes.
There is a rich heritage of Ayurveda. The other system of medicines are only a few hundred years old, but Ayurveda is prevailing since the Vedic times.
Okay.
It's 5,000 or 10,000 years old there.
Parashar sir, but research हो रहा है, the scale at which MBBS में research होता है, the rigor with which MBBS में rigor होता है, is that applicable to the alternate system of medicine also? I would also want Dr. Manisha to answer this after Dr. Parashar has taken in this question.
So there is a rich heritage, and much what is happening in India. A person is going to allopath or Ayurvedic physician or someone, but ultimately he is not getting the right treatment. The reason, no system of medicine is complete in itself. And if we are experimenting, so it will offer a comprehensive and holistic approach to healthcare. It will address the limitations of all the systems if they are being used individually, and it will be in favor of the patient. After all, if we think that the patient welfare is the most important or the first priority of a doctor or the nation. So if the government is considering integration of both these pathies, there is nothing wrong. And there are so many medicines in allopathy which are hepatotoxic. Most of the tubercular drugs, rifamycin, isoniazid, paracetamol, these are hepatotoxic. Painkillers, antibiotics, and so many other medicines, these are hepatotoxic. And if they are given along with Ayurveda medicines, the patient compliance can be much more, and the patient will be ultimately benefited. Because what we see in practice, a TB patient is non-complying the whole course, which may be a 3 month or 6 month, because of the side effects of the medicines.
GG.
He loses his appetite, he's vomiting in the morning. But if we are giving an Ayurvedic hepatoprotective preparation along with the tubercular medicines, there is full compliance because the patient is getting benefited. Similar is the case with all other medicines. And moreover, what is happening today, in spite of the research, the so-called evidence-based research in allopathy, the lifestyle disorders are increasing.
Yes.
Diabetes, hypertension, these are on an increase. And if we apply the basic principles of Ayurveda and the medicines of Ayurveda along with the allopathic treatment, it is certainly in the best interest of the patient. And the side effects of the allopathic medicines can be overcome by Ayurvedic medicines if these are being given simultaneously.
Dr. Manisha, I would like to ask you about the rigor that is put into providing MBBS, research, medical research, the rigor that is put into bringing out a paper, the rigor that is put in documenting. We don't see that in alternate system of medicine, or is that doesn't that not hamper the kind of education that we will offer to our students? And ultimately, like Dr. Mittal very rightly said, what you teach your students is what will come down to the patient.
He is so correct. I completely agree with Dr. Mittal. What is being taught to the patient, to the doctors, only 20-30% trickles down, because that is how it is. Coming to the point whether Ayurvedic medicines are subjected to such rigorous trials. So there is a body called DCGI, and every modern medicine which is coming since 200 years is a new molecule. They are target-based medicine, one target, one molecule. And unless you rigorously test it, it is very difficult to list with the DCGI. And that is a government regulation. Such kind of government regulation really does not exist when it comes to Ayush medicine, and that has to be done by the government. If you're bringing a new patent medication, kindly do an RCT, which should be well recognized, and accordingly launch the product, and that will make a lot of difference. Coming to the classical preparations, since they have been around for certain point of time, they are deemed as something which give results and safe. And a lot of reverse pharmacology has been happening on herbs, especially Brahmi. A lot of work has been done on ashwagandha, turmeric. Single herbs have been picked up, and the studies have been rigorous. I think CCRIS does take in a lot of research on these kinds. And slowly and steadily, the PG students of every college which has offering PG, they also do it, but it should become more rigorous. I agree with that.
So tradition cannot replace rigor, isn't it, Dr. Rajiv?
Yeah, that is true. As I mentioned in the beginning, the foundation of modern medicine or science, as we call it, is evidence. And it is not whether somebody has been believing it for, say, 200 years or 2000 years or whatever. It is whether you can test it or not. So I'll give you an example. So this was an incident that occurred when I was training in ERCP. That's basically a specialized endoscopy in New York City. So this happened in the theater, and this patient had some gallstones which had trickled down to the bile duct, and we were trying to get rid of them. And we couldn't get rid of all of them. So some stones were left behind. So I asked the professor, can we give this patient this particular medicine so that the gallstones will dissolve away? So the professor, through his mask, looked at me and said, why do you say that? I said, one of my professors used to prescribe this medicine, again, back in the US. He said, no. Where is the evidence for that? I had no answer. My only answer was a professor used to say that. See, that's the point here. Again, this is in the modern medicine. I'm not talking about Ayurveda here. Even in modern medicine, we have to improve the scientific temperament here. So I looked up the literature, scientific literature. Clearly, there was no proof. It was just an opinion. So the point I'm making here is there's plenty of opinions about, not only in India, but in so many other countries, about traditional healthcare systems and how they work and how they don't. But those are just opinions. They've not, for the most part, been tested through rigorous clinical trials. So until something is tested through clinical trials, they can be randomized or patient case series or anything. And their side effects also have to be reported. See, the point about modern medicine is it's very transparent. I'll give you an example of side effects. Let's say I go to the beach. Are there any side effects about going to the beach? No. But actually there are. For instance, you will get sand on your feet, which is not something you wanted when you went to the beach, right? So when you come back to your vehicle, you'll have sand on your feet, right? Now that is a side effect. Yes, that if you're honestly reporting it, yes, it can be reported as side effects of going to the beach. Your foot can be cut through shells that are on the beach. That is a side effect. That is exactly what I'm saying. See, the transparency that modern medicine has shown has been used by certain other quarters to criticize modern medicine, saying that modern medicine is full of side effects. No. When modern medicine treatments are given, the doctor will tell them, look, or it is there in the literature saying, if you take this preparation, these are the benefits. And if you take this preparation, these are the potential things that can happen. It is the patient's right to know, but that does not exist, as I understand, with most alternative systems of medicine. So there's an illusion that these things are safer than they are and there are no side effects. That is not true. I work in gastroenterology, and if I talk to my liver transplant colleagues, people who do liver transplant, they'll say a good number of liver transplants are coming in because of unauthorized herbal preparations. Yes, I repeat, I'm not sure if they're Ayurvedic or not, but as I said, I'm not qualified in Ayurveda, but herbal preparation.
We seem to have lost Dr. Rajiv here. Dr. Manisha, we'll continue with the debate. You know, knowing how rigorous both MBBS is and how rigorous BMS course is, does the time economics work out for the student? I mean, do we need to add to more years of study, of training and practical work?
Okay. Not if you're asking purest way,
So if you do integrate the
they are
course,
complete right now in their way. They are 5.5 years.
Yeah, 5.5
good
years.
enough time for. Am I audible?
Yeah. You're audible. Yeah.
Is a good enough time because everybody goes ahead and practices specialty. They will go and do some 3 more years, and there's a lot of years put in.
Yeah.
So 5.5 years, I think, are really wholesome for any kind of basic study which is related to medicine. At least there is what you can say, we give sort of a drive to the person, okay, this is what it is, these are the basics, now work on it. Right. So it's simple for general practice, it is rigorous. And Ayurvedic student also has to study modern anatomy, physiology, a part of pharmacology. I've been teaching pharmacology for quite long. So we have imbibed part of it in every subject so that the doctors who come out as BMS are aware of what is the medicine, the other parallel medicine. And I always call the sciences as complementary sciences and not alternative. There's no alternate for each other. Everybody has their own merit. And I give all the merit for the modern medicine. It is not that amount of love and money which has been put in for a lot of research, which strangely Ayurveda has become the poor cousin who's not got so much of funding to do this extensive type of research.
Yes. The funding has always been an issue. Funding has always been an issue.
It's like there is a party and this is one poor cousin who is standing in the corner and expecting so much out of rigorous studies. There has to be a government system where they say, okay, this is amount of research money put in Ayurveda and this is the kind of research we are looking for. Yeah. And that really sets the system.
Okay. Ma'am, we have a question from one of our Hindu viewers. They are saying that at present, more than 50% rural healthcare depends on BAMS, graduates. On BAMS graduates. And additionally, at all hospitals in big cities, the registrars are BAMS or BHMS graduates. So how would you, also Dr. Mittal, how do we tackle this? Should I repeat the question? Dr. Mittal, can you hear me? Dr. Mittal, your mic is off.
Yeah, could you please repeat, ma'am? Actually,
so they're saying that, BMS, BAMS and BHMS graduates, they take care of 50% of the rural healthcare. And even in big cities, they are employed into the allopathic system of medicine, is what I'm presuming that our viewer is saying. So how do you tackle something like this? Because anyway, they are there in the hospital. They are part of they are integrated into the hospital and treatment system. So you might as well teach them and, ensure that they are offering a knowledge-based service.
Ma'am, to be very frank, as far as I know, ये जो BMS, BHMS या कोई भी पैथी है, I guess they are not मतलब eligible for doing work in the ICUs, जो भी allopathic जो modern medicine के hospitals हैं specifically. But बहुत सारी जगह पे, if you talk about the small towns, है ना, I also belong from a very small town, Shri Ganganagar in Rajasthan, which is just 7 kilometers away from Pakistan. In Pakistan, we share international border also, and in the major cities also, if we see in Delhi and major cities like Bangalore, there are big hospitals, some hospitals where they are recruiting the BHMS and other pathies just because they are getting employment in a less amount rather than the MBBS. But this is totally unethical. As in the recently Madhya Pradesh, there is near about Gwalior, there is a city whose CMHO, Chief Medical Health Officer, also issued a notice also to all the nursing homes and hospitals of that city that kindly please do needful in this regards, that there has been found cognizance that some BHMS and BMS or even the nursing some officers are employed there as a duty duty worker, doctor duty on in the night evening shifts or even in the night shifts in the ICU, which is totally based on the modern medicines. And on other hand, when the sir is talking about Parashar sir is talking about the China, their Chinese traditional medicine, sir, इस पे मेरा एक चीज ये कमेंट है कि जब हम भारत की बात कर रहे हैं कि लोकल अपनाओ, भारत अपनाओ, तो चाइना की ट्रेडिशनल मेडिसिन कहाँ से आ गई? वो चाहे कितना ही बेटर कर रहे हो, हम क्यों फॉलो करेंगे सर? चाइना की बात यहाँ पे ना लाई जाए तो इट विल बी वेरी बेटर कि चाइना किसी को हर भारत अपनी जगह, दूसरी कंट्रीज अपनी जगह सर, भारत और चाइना का कंपैरिजन नहीं हो सकता. और दूसरी बात जो रही कि हिपेटोटॉक्सिक ड्रग्स हैं, ट्यूबरकुलर, सर वी हैव ऑलरेडी ट्रांसपेरेंसी है, प्रॉपर ट्रांसपेरेंसी है, वी हैव बीन गिवन, पेशेंट को बताया जाता है. रिफेम्पिसिन यू आर टॉकिंग अबाउट, रिफेम्पिसिन हिपेटोटॉक्सिक है, एंटी ट्यूबरकुलर ड्रग है, ओके, बट उसमें हम ये भी बताते हैं कि यू कैन हैव यूरिन, ऑरेंज कलर्ड यूरिन, और यू कैन, इट कैन अफेक्ट ऑन, सो प्लीज ड्रिंक मोर वाटर एंड ऑल दीज थिंग्स, है ना. वी ऑल्सो एजुकेट देम सर, बट you are saying experimenting is good, but the patient care is also should be utmost importance. How can it be amalgamation nahi ho sakta iska possible?
Dr. Mittal, we want to make a small announcement. We want to make a small announcement for all our viewers who have tuned in. Please feel free to ask questions to our panelists. The 3 best questions will get free Hindu online subscription also. So we are welcoming questions for our panelists. And I, like Dr. Manisha and me, we were having a quick catch-up discussion just before the session began, and we were discussing exactly what Dr. Mittal and Dr. Parashar was talking about. China already having integrated this. Japan is in the process of integrating their traditional form of medicine. So what is the harm if we tap into our richness, our diversity, and our knowledge base? इसमें इतना क्या गलत हो रहा है? Both Dr. Manisha and Dr. Rajiv. Dr. Rajiv, your mic is off.
Yeah, first of all, I want to point out that's a wrong statement. We are talking science here, and science is based on facts. China has not integrated their traditional Chinese medicine to modern medicine. The two systems exist in parallel. I repeat, they are not mixed. And that's a fact. It is true that the Chinese traditional medicine has come a long way from they were founded many centuries ago. Many of these, their treatments, some of which, for instance, are animal organs. For example, in the ancient days, they used to go hunting, bring wild animals, and it is a belief that some of these animals' organs were helpful in certain disease conditions. So the Chinese medicine traditional system is based on yin and yang. Yin is anything that's cold and dark, and yang is anything that is hot and light or bright. Now, there is no way you can scientifically prove that a disease is because of yin and yang imbalance, but I can imagine 1,000 years ago, nobody knew what a cell was, nobody knew what a receptor was or a hormone was. Back then, with the knowledge they had, they thought that this was an imbalance. Now, I repeat, Chinese medicine, in fact, some of the top research papers come from the Chinese modern medicine doctors. So please don't be under the impression that China has integrated the two. That's completely wrong. So that's first step. The second thing is, I heard about Dr. Mittal's statement about rural practice. So let me give you an example. There is a shortage of doctors in rural India. There is no doubt about that. But let me give you an example. Suppose a hypothetical country has a lot of poor people, not India, I'm just saying hypothetical country. How do you solve that problem? Just by printing extra currency notes, can you fix that problem? You can't. You find out what is causing the poverty and you fix it, right? Likewise, you find out what is causing the lack of doctors in rural sector. It is because of lack of infrastructure, lack of ability to bring up families. These are young doctors who have just started their families. And if the infrastructure is poor, their staffing is poor, their reimbursement is poor, their support network is poor, they feel unsafe, they will not go there. They will flock to the urban areas. That is where unemployment of doctors is happening right now. Not just among modern medicine, but other doctors as well. So just by increasing the number of seats or by asking other systems to prescribe modern medicine, we are not going to solve this problem. To solve any problem in modern medicine or in science, you have to look at the root cause. So the root cause of the rural practice deficiency in India is very clear. Doctors do not want to go there for certain reasons. So those reasons have to be fixed, and it is not by increasing the number of seats. So that is just a point. My connection got cut off at the point of polypharmacy.
Yeah.
Polypharmacy is about multiple medicines being used. Now, that is not something modern medicine encourages. Even with our doctors, we try to ask them to cut down the number of prescriptions. But with traditional systems of medicine, which are plant-based, every plant has preparations have dozens and dozens of chemicals. And if a treatment apparently works, we don't know which chemical actually worked. And if a patient died as a result of the treatment, we don't know which of these agents also cause a harm. So it's important, as Dr. Manisha said, to conduct research to isolate and purify the active ingredient and find out what it is and subject the isolated ingredient through randomized trials and further that science. Yes, Ayurveda needs to be refined, no doubt about that. But adding a mixture of herbal medications to a critically ill patient, that is compromising the patient's safety. It can interfere with the liver's drug excretory systems. It can cause further damage to an already failing kidney. So I'd be very reluctant to subject any of my critically ill patients to a preparation that contains multiple plant-based products. So make no mistake, mixing Ayurveda or traditional systems in modern medicine will compromise patient safety. And also it will reduce accountability. The person who's prescribing will have no idea which one is working, which one is not, and why not. So let's get this out of the way. One, China has not mixed the preparations, mixed the two systems. They exist in parallel. And second, mixing traditional mixtures of plant-based potions is not scientific the way modern medicine sees it. And lastly, I'll say this, that if all countries respect their traditional systems, imagine if all of them, say African countries, South America, where the shamans practice spiritual medicine and hallucinogens, imagine if they all diluted their modern medicine with their own traditional medicine, thinking that theirs is the best. Modern medicine will stop existing. We'll be going backward in the wrong direction. So let's not make a mistake here of saying that the two can be mixed together. It is true that these systems have existed and have their own merits, and they are authorized systems. They need to be practiced. They're popular. That is true. But that's not to say that they can be mixed.
Okay. Dr. Manisha and Dr. Parashar. We'll start with Dr. Manisha. Ma'am, would you like to respond to this?
So coming to the part that polypharmacy in terms of Ayurveda has polyherbal compounds and we use it. And the view is network pharmacology, which I think modern medicine currently is exploring in terms of cancer. A single medicine which is targeting multiple systems and working on it, and that is what Ayurveda looks at. Polypharmacy, of course, nobody is interested in doing, but there have been times and places where people have used certain Ayurvedic medications to counterbalance any kind of discomfort which a medicine needed for that therapy, which is of modern origin, could have caused. And would that cause any kind of danger, trauma? Of course, it is not studied, but if the symptoms subside and the person is feeling better, nothing further is done. And I always tell this, Ayurveda lacks a lot of rigorous trials because that requires a lot of funding, and that has to be, the government has to make certain plans and arrangements so that Ayurveda also can enter this field, which Dr. Rajiv correctly said, that TCM is extensively researching its herbs and publishing papers, and that's what makes it more accessible to people all over the world. And that is what Ayurveda should also look up to. And it needs a lot of government support because, again, I said it is the poorly funded cousin in health sciences which needs support through government.
Dr. Manisha, also, is the alternate system of medicine, are we looking at prevention or are we looking at treatment? Is there a basic underlying difference between the two systems of medicine where modern medicine looks at treating, while the alternate looks at a more holistic prevention?
Yes. So it is, I can't tell you the profoundness of wisdom which Ayurveda holds, and I think everybody will agree with it. It is all about taking health preservation. At the very beginning, there is dinacharya, and it is all about lifestyle and diet. And if at all you fall ill, then comes therapy. And modern medicine is completely precision based. People go there in acute conditions. There is accident, there is trauma, there is severe illness, and they have done amazing work. And and that is something even Ayurvedic doctors tell, if there is something emergency, please go and get it repaired, restored. When it comes to Ayurveda, it is preventive science. It is also therapeutic. Where does therapy come in? It comes in NCDs. It comes in lifestyle problems. It comes in autoimmune conditions. It comes in chronic conditions, which even modern pharmacy knows कि इसके बाद मेरे पास कुछ नहीं है. And there are doctors who tell you can explore other options. So it is that when people say other options, you can very early start incorporating the holistic approach and see the changes in multiple such conditions which really require a lot of attention, because right now we have a lot of population which is aging and has multiple problems which need comprehensive care, which needs holistic care, which needs immune reset, and it all comes from Ayurveda.
So, ma'am, we, like to all the panelists, we now understand that human body is not existing in isolation. Everything affects us. Our mind, our body, the environment, our genes, social structure. It affects us in a positive way. It affects us adversely. So, mixing of pathy may work, may not work, but we also need to see the basic logistics of it. Do we have the infrastructure to hold such an integrated course if we do offer it? Dr. Parashar, would you like to take the question? So your mic is off.
When it is said that research-based evidence, we have a rich heritage in Ayurveda, but the foreigners burnt our libraries and all the evidence we had. And now the government is considering again to grant more funds to the alternative system of medicines and to start research work in these pathies. So it's on the way. Again, I will say that what is written in our literature, it has never been proved false. For example, a medicine is written for a particular drug, so it will work. It is definitely an evidence is needed, but we can't say that if evidence or our literature that has been destroyed by the foreigners, we are wrong or we are false.
Yeah.
Right. Again, I'm coming to the funds. Only 2.5% of total health budget was allocated to Ayurveda. But again, I will say that during the last 10 years, the scenario has been changed and the government is allocating more funds to Ayurveda and research work has been started. Research papers, journals, these are now full of Ayurvedic research-based experiments and their results. Again, I will say that already the practice is prevailing. There are so many molecules in the market, so many products are in the market where allopathic and Ayurvedic preparations are present, and these are being written by the allopaths in their own interest. For example, curcumin for autoimmune diseases and for increasing immunity. We are using products having ashwagandha or curcumin along with that. We have harjod, Cissus quadrilanguis. That is one of the best medicines used in Ayurveda for bone health and for fractures. So now there are so many products in the market which are having allopathic drug along with harjod. So they present in the integrated form and these are being used all over the country. And now I will come to the point of appointing medical officers in allopathic hospitals. As far as legal status is concerned, the Central Council for Indian Medicine that was established in 1970, and there is a clause in the IMCC Act that the state may make regulations to allow a person to practice allopathy in spite of he is not qualified in allopathy. That means already the act is there. Now the Central Council has been replaced by National Commission for Indian System of Medicines, and the same clause is there. It is not being removed. So again, at the national level, we can say that the government has allowed allopathic practice by other system of medicine, especially Ayurveda and Unani practitioner. And before even independence, there is the Special Province Act 1939, which was in force before independence. That was clearly stating that except Schedule H and X drugs, the Ayurvedic practitioners can use allopathic medicines. Similarly, in the Drugs and Cosmetic Act, Rule 1945, we are granted this opportunity or right. We have got the right to practice allopathy, and it is being widely used. As you said that this allopathic medicine is not being practiced, so it is not the truth. Again, I will say rural health. It is the according to the WHO ratio. There are doctors of modern medicine in India, but they are either practicing in the corporate hospitals or they are centered in the cities. Again, the rural health is being kept for Ayurvedic doctors. They are supporting the rural health. This is the hard truth. The primary health centers were not, the vacancies were not filled there because nobody wanted to go there and serve the rural people. This is Ayurvedic practitioner, which is or who is practicing in rural India and serving the rural people with dedication.
Okay, so we have a question again. I'm sorry, I've we are running short of time. We have a series of questions that have come in. So I want to take one more question. It says, Dr. Manisha or Dr. Parashar, any one of you, it says that modern medicine has eliminated smallpox and is able to prevent rabies and tetanus and there are various other diseases through vaccine. Antibiotics also cure some deadly diseases. Has Ayurveda eliminated or prevented with a guarantee of I think he says, has it been able to prevent any of these deadly diseases even in 1,000 years? So I'm reading verbatim from what has been. So yeah,
So,
anyone
well,
you
once it comes, rabies is something where it is somebody biting you, and you should have strong immune health to not develop it. So, it is all about immunity. And this is where Prakriti comes in, the phenotyping and the genotyping, where we already tell that these kind of people have poor immune health and they are prone to certain kind of disease risks. So, talking about tetany or rabies, how can it be prevented? By improving your immune health so that you do not your body is able to fend itself in such adversity. That
But
being
rabies,
first.
we would also like to make it clear.
What has
Yeah, rabies, I would
been
also like to put in a rider. Rabies, if not attended to, is also 100% fatal.
Of course it is.
Yeah.
So
So
I'm not
just
saying
clear
I'm
with your,
treating it. What
yeah,
he's
is
asking, have you
100%
prevented it?
fatal. Yeah, yeah.
It is about prevention. The point is
Yeah.
prevention, and prevention is completely how your immune health reacts to whatever things. We are so many people in India. Not everybody gets TB, and TB is such a bacteria which is slow growing, and anybody can catch it. People with poor immune health and certain kind of conditions are prone to TB. That being one. Rabies, again, it is how your immune system that day reacted and you fell ill. Same with tetany. Now coming to antibiotics and coming to this part of being transparent, we talk about side effects. Ayurveda does, every herb has been mentioned if it has side effects and the antidote to it. What to do in cases if it has side effects. Ayurvedic medicines do have side effects. Ayurvedic herbs do have side effects. Even coming
Like
to
we saw,
haldi,
like we saw in the case of turmeric, like we saw in the case of turmeric, which is so widely used in India. We I think abused that turmeric so much during COVID.
I'm telling you that
Yeah,
Indian dietetics is so beautiful. It is brilliant. The way turmeric is, we talk about curcumin, one part of turmeric. As a whole, it is not easily absorbable in the body. It becomes a prebiotic. For it,
yeah.
it needs some sort of lipid to get absorbed. That is why turmeric लाते. पर जब हम सब्जी खाना बनाते हैं, हम छौंक देते हैं घी में. We add some pepper to it, and in every meal, one person in a whole day gets 100 to 200 milligrams of turmeric, and that is more than enough for prevention. Now, adding more supplements because XYZ has done some study on cancer. This is where we fail without understanding the study might not be meant for Indian people who have turmeric in their dietary guidelines. And this sort of wisdom might come if there is an integration of things, because silos में ना चीजें नहीं होती हैं.
जी, जी.
And there are so many things, even talking about endometriosis, it is still hypothesis. This is the reason, this is the reason, and still it is proven the person is still given something to block the hormones. And that is where I think a holistic approach is the need of the hour for people who really have autoimmune and chronic problems.
Dr. Rajiv, I would like you to take this question on again. We've discussed this briefly during our discussion, but I'd like to address it directly again, and I'd like to come to you. Both MBBS and BAMS colleges are struggling without adequate manpower and infrastructure. So integrating them, are we straining a system further just for the heck of it?
Bindu, who's the question for?
It is for you, sir.
Okay. I think Dr. Mittal has already answered that question.
Yes, Dr. Mittal touched upon it briefly. I'd like you to. You're a teacher. You have been, you've been dealing with this. Do we have the infrastructure and manpower to cater to this integrated system?
Dr. Mittal.
No, this is to you, Dr. Rajiv.
Okay, yeah, absolutely not, because as Dr. Mittal had said, the medical curriculum itself is pretty intensive. To pass the MBBS course according to global standards. I talked about global standards. Yes. Remember, India does not exist in a box. India exists in a world that is fiercely moving forward, rapidly moving forward based on science. So what we need to do is to improve the quality of our existing medical colleges, the curriculum, make sure that the empty slots are filled in terms of faculty, to have audits, make sure that the education is carried out according to the expected standards, and to add another entirely different system into their curriculum of a 19-year-old or a 20-year-old that joins this course will be suicidal, in my opinion. That's one. The second thing is, we heard about, Dr. Parashar talked about independence. Now, let me take our viewers through this. Do you know the life expectancy in India at the time of independence? It was 32 years.
35.
Now the life expectancy in India is 70 after the onset of modern medicine, despite all the lifestyle changes. Now, that brings us to the second question. If the ancient traditional systems were so good, why were people dying at the age of 32, or the average life expectancy was 32? That's a very straightforward, evidence-based question. That's a very plain question. That? The second is about rabies. I heard a comment. Now, make no mistake, if a dog bites you, make sure you see a doctor, get it assessed, and get the vaccine. If you don't, you will die if the dog had rabies. Make no mistake, immunity has nothing to do with rabies prevention. So rabies prevention can occur if you're always exposed to dogs. Yes, you can get a vaccine ahead of time. It's called pre-exposure prophylaxis. But if a dog bites you, don't even think that my immune system will fight rabies. It'll kill you. At 80% is your risk of death from rabies. The second problem I see is snake bite. Many people go to traditional healers. I'm not saying it's Ayurveda. If a snake bites, you know what? Some actually survive. You know why they survive? Because if you look at snakes, poisonous snakes, about a good percentage of them, the snake actually does not inject the poison. Nobody knows why the snake does not do that. They're called dry bites. Now, these healers use these examples to show that even if a cobra bites someone, I heal them. Now, make no mistake, again, if you've been bitten by a snake, go to a legitimate practitioner and get the antivenom. Whether it's required or not, it's a doctor's call. So there are so many issues here that are unclear, but I just wanted to make it clear. And the last point I will make here is about lifestyle. The lifestyle that we have now was not the lifestyle that existed, say, 1,000 years ago. The challenges were different then. Back then, it was all about injury, farming, malaria, mosquitoes, and other infectious diseases. Right now, we have mobile phone screens. We have physical abuse. We have mental abuse. We have so many other issues, sedentary habits, people sitting on computers, not exercising. So yes, it is true that all systems of medicine must address these lifestyles right now, because if we don't do that right now, we're going to have a large number of lifestyle-based diseases, including heart disease, hypertension, stroke, diabetes, cancers coming at us at a rapid pace. So all systems have to work together to reduce this. And I'll conclude by saying this. Many people have the impression that modern medicine is about writing prescriptions. No. When my patients come to me with fatty liver, I assess their lifestyle and I say, look, you got fatty liver because of the following lifestyle anomalies. You have to get off that couch and start walking. You have to reduce your belly. Your abdomen is too wide. You have to reduce your belly fat. You come and see me in 3 months after you follow this regimen of diet and exercise. That is what I tell them. I don't write prescriptions for benign fatty liver. And that is evidence-based medicine for you. So it is not about modern medicine ignoring lifestyle. We are constantly updating ourselves in terms of what are the challenges, and also recommending treatments only if they are proven. If modern medicine were prescribing treatments that were unproven, all patients with fatty liver will get 15 different medications. That is not the case now. At least the guidelines say that there is no medicine that is required for benign fatty liver. Yes, there are some situations where you prescribe certain medicines, but that's a minority of patients. So I just wanted to mention the lifestyle part. The lifestyle now is not the lifestyle that was when these systems were invented.
Yeah. So we have already overshot our time. I'm very keen to hear what Dr. Manisha has to say.
I just wanted to summarize why did we have low life expectancy at 1947 was, I think, because of multiple famines and poor living and feeding conditions. And that is one of the reasons. That could be one of the reasons. I'm not sure. I was not born then, but this is a conjecture that I wanted to share.
Okay. Dr. Mittal, I'd like to hear from you about this topic. Though you did say कि बहुत मुश्किल है सबको मिक्स करना, डॉक्टर्स नहीं है, इंफ्रास्ट्रक्चर नहीं है, बट सारा मिक्स करके आप अगर दे रहे हैं तो ये सुइसाइडल है.
Exactly, ma'am. As you have asked
I
about
think
the
Dr. Rajiv
infrastructure and
used the
all,
word that it's suicidal.
recently
It's
might
fatal.
be you are aware of that in Rajasthan, in the northern parts, in Uttar Pradesh also, there are some medical colleges, not private, even the government medical colleges, the first year and second year MBBS students are learning from directly from the YouTube. Even they have the in the classrooms, they are projector pe YouTube pe directly they are teaching, learning from the ऑनलाइन प्लेटफॉर्म्स. मतलब इस तरीके का एनवायरनमेंट ऑलरेडी है. अभी रिसेंटली राजस्थान में आप देखेंगे, उदयपुर इज अ वेरी ब्यूटीफुल सिटी. वहां पे R&T बहुत पुराना गवर्नमेंट मेडिकल कॉलेज है. अभी रिसेंटली विद इन एक हफ्ते पहले की बात है, वहां पे एक पीजी रेजिडेंट को इलेक्ट्रिक करंट लगकर डेथ हो गई उनकी. सो व्हाट, मतलब किस तरीके का इंफ्रास्ट्रक्चर हमारे पास अभी है. आई गेस मतलब एट द एंड आई वुड से कि मुझे लग रहा है कि पहले चाहे वो आयुर्वेदा है, चाहे वो मॉडर्न मेडिसिन है, हमें पहले जो हमारे पास है ऑलरेडी, वी शुड वर्क ऑन दैट ओनली, है ना. अपने अपने पर्सपेक्टिव में हम सोचते हैं कि हम इधर भी चले जाएं, उधर भी चले जाएं, सारे हाथों में लड्डू लेके घूमे. दैट इज नॉट एट ऑल पॉसिबल. हमें पहले जहां हमारी वीकनेस है, जो हमें इंफ्रास्ट्रक्चर, जो बेसिक थिंग्स हैं, पहले वो रोबस्ट करनी पड़ेंगी वो सिस्टम्स को. then we can do experimentation and all, because ये एक तो पेशेंट केयर पे भी डायरेक्टली इम्पैक्ट करेगा, प्लस जो मेडिकल स्टूडेंट्स जिनको ये करना है MBBS BMS इंटीग्रेशन कोर्स, मुझे लग रहा है यहाँ पे जो पैनलिस्ट हैं वो इस चीज से जरूर अवेयर होने चाहिए कि उनकी क्या राय है, उनकी क्या फीडबैक है. वो ऑलरेडी इतना सफर कर रहे हैं, उनके पास इंफ्रास्ट्रक्चर, उनके पास मैन पावर, तो उसका ये मतलब नहीं उनको एक और एक्सपेरिमेंटेशन में डाल के उनको बोले कि आपको MBBS वालों को बोला जाए कि यू गाइज हैव टू आल्सो स्टडी द आयुर्वेदा सिस्टम, एंड आयुर्वेदा वालों को बोला जाए नहीं, आपको तो फार्मा के ये ड्रग्स याद करने हैं, हाँ जी, आपको इसकी प्रॉपर सारी नॉलेज होनी चाहिए. वाई? उनको जो पहले जो उनका सिस्टम, अभी आयुर्वेद कितना अच्छे से तरीके से हमें भी पता चलने लगा है, आम जनता को अब पता चलने लगा है कि क्या एक्चुअल में आयुर्वेदा है और क्या फेक हर्बल, जो मतलब कितनी कंपनीज हैं जो फेक, मतलब कितना कुछ चल रहा है. हम तो हर चीज को आयुर्वेद समझते थे, हम तो सोचते थे कि चूरन और च्यवनप्राश ही आयुर्वेद है. नहीं, बट अब अगर ये वापस अगर फिर से ये कुछ इंटीग्रेशन वगैरह कुछ हुआ, तो इससे जो आपने पहले बात बोली थी मैम कि जो एथिकल अनएथिकल जो प्रैक्टिस है वो भी इंक्रीज हो जाएंगी. जो लोग कुछ भी बिल्कुल, उनके पास ना कोई आयुर्वेदा का कोई डिग्री होगी, BMS होल्डर होंगे, ना MBBS होंगे, और कुछ फालतू का उनके पास थोड़ा बहुत नॉलेज होगा विदाउट एनी MBBS और BMS कोर्स, और इंटीग्रेशन तो दूर की बात है, इनके पास बेसिक ये डिग्रीज भी नहीं होंगी, एंड दे विल कम टू द प्रैक्टिस एंड धड़के से करेंगे वो, एंड दे विल से वी हैव डन द इंटीग्रेशन कोर्स. इस तरीके से प्रैक्टिस, जो मेडिकल एजुकेशन का स्तर है वो बिल्कुल डिग्रेड होता होता ग्राफ नीचे चला जाएगा इंडिया का.
जी, डॉक्टर पराशर आप कुछ बोल रहे थे.
It's not a way of burdening the allopathic students. If we talk about Ayurvedic and Unani students, we are learning the physiology, the pharmacology of modern scientific system along with our own system of medicine. So, and we are doing it very easily. There is no problem. So it's not a way of burdening, or it's not of experimenting or paralyzing the system. It's a way to promote health for the common people. The government is considering the issue to benefit the common people against the money it is spending on preparing a graduate of medicine, whether it is from Ayurveda or allopathy or Unani or homeopathy. Secondly, if we talk about experimentation again and research based, so we are already on the path, and so are the papers now. We are appearing in the journals, and a day will come. Not it's very far away. Within a year or so, the journals will be flooded with our research papers, I can say, because we are already working on it. Thirdly, the funds. The government is already increasing the funds, and it is on the way. So we hope that the future will be in favor of the common man. And the that it will happen like this or that, it is not the case. I'm giving an example. I saw a product of bone health, which was having one of the constituents as egg shell membrane fine powder. We give in Ayurveda kukutan tvagvasam, means the eggshell membrane that is subjected to make it a bhasma, then it is not harmful for the body. But if it is being given in the eggshell membrane fine powder, definitely it will harmful. So we can say that integrating both the systems will be helpful and not in
detrimental.
Yes.
Yeah.
And again, I will say that we should welcome if there is something for a common man. We are citizens of India. We are citizens of Bharat, and we should think of Bharat and not we should
What
be
about China
self-centered.
also, sir? We
That
are
I would say.
citizens of Bharat.
Dr. Parashar,
Again,
Dr.
the
Manisha,
government
Dr.
is
Mittal,
considering.
and Dr. Rajiv, thank you very much. We have overshot our time, and I know this is a discussion which we could. It's a very interesting discussion. It affects every single individual because we all are human beings. So thank you all for your time and your valuable insight. And for our audience and all of you, we wish to see you back on the Hindu platform for more such updates and more such debates and more such information. And we wish you all a very happy and healthy weekend. Thank you.
Thank you so much. Thank you, Dr. Rajiv. Thank you, Dr. Mittal. Thank you, Dr. Parashar. It was so lovely listeing to you all. And thank you, Bindu. You have been amazing.
Thank you. Thank you. Thank you.
It's such a pleasure to have this panel because it's, I always say this, in modern medicine or in science, I learn from people who disagree with me. I learn more from people who have different perspectives. So that's just how I learn. Thank you.
Absolutely.
That's how everybody learns. We
also saw your notes, Dr. Rajiv. We also saw your extensive notes.
Oh, thank you.
We loved your metaphors. It was so Ayurvedic. I loved it.
Oh, yes,
so
of course.
We hope to see you all
it's
back
good.
on
It's
the
good.
panel.
I think all of you spoke very well, very
you
clearly,
so
and with conviction. And that's important to speak with conviction. Yeah.
Thank you so much. Yeah. Thank you so much to all of you for your time. Yeah.
All right. Yeah.
Thank you.